The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone and welcome to our online information session for courses open to international students that are available at the Leeds Institute of Cardiovascular and Metabolic Medicine. My name is Finbar Cronin and I'll be hosting today's webinar. We are presenting to you live, so please bear with us for any technical issues. Can I ask that you now check your speaker levels and adjust the volume as required? Please type into the chat box if you can hear us. If you have any issues, please say, sorry, no, can't hear, and we'll try and resolve those for you. This session will be a presentation lasting approximately 40 minutes. It will introduce you to medicine and healthcare courses at Leeds, explain who the courses are for, and the entry requirements for each course. Afterwards, we will open up to a question and answer session where you can type in your questions to us. You'll not be able to use your microphone. Welcome to the University of Leeds, which is the third largest university in the Russell Group. We teach over 33,000 students from 151 countries and employ 7,800 staff. Our campus is 10 minutes walk from Leeds City Centre, and our School of Medicine buildings adjoin the Leeds General Infirmary hospital site, which allows ease of access for our staff and medicine and healthcare students. Leeds is building on its existing research strengths and commitments to interdisciplinary working, specifically in health. We have a close working relationship with the Leeds Teaching Hospitals NHS Trust, which is the third largest NHS trust in the UK, and we attract significant investment from a range of charities and research funders. The Leeds Institute of Cardiovascular and Metabolic Medicine focuses on laboratory, clinical and applied biomedical research into common chronic disorders and non-communicable disease. This includes research into cardiovascular disease, diabetes, cancer, neurodegenerative diseases, reproduction and early development, child health, and life course epidemiology. We teach 3 undergraduate courses, 2 medical intercalation courses, 7 postgraduate courses, and we run the International PhD Academy. I'd like to introduce you to our first presenter, Dr. Ruth Brooke, who will briefly explain details about our undergraduate degree in audiology.
Hello everyone. For those of you who aren't familiar, I'd just like to start with a brief overview regarding what audiology is. So audiology is the study of hearing and balance. And audiologists therefore assess, diagnose and treat patients, both children and adults, with hearing and balance problems. The University of Leeds course is an undergraduate degree course, and it trains students to become audiologists. And on graduation, our students are then eligible to register and work as an audiologist, both in the NHS and the private sector. To gain entry onto the undergraduate course here at Leeds, international students must complete the International Foundation year first. So it's a 1+3 year degree course. 1 year on the International Foundation year and then 3 years for the degree. The entry requirements for the degree course include that students must have an A-level in science, and this is because there's a high science level content in the degree, and we find that students struggle if they don't have that background in science. We require A, B at A-level or equivalent, and including a high level of maths, English and science GCSE or equivalent at grade B. We do require an English level of IELTS 7 with no less than 6.5 in any component. However, you should check the entry requirements for the International Foundation year, as this includes more details regarding international students. Entry onto the degree course includes successful completion of the International Foundation year and then selection at multiple mini interviews for applications to the degree. Students are taught about the multiple mini interviews during the International Foundation year. Fees for the audiology degree course are available on the University Course Finder website. What does the course involve and why choose Leeds? There are only a small number of audiology courses in the UK, and a number of elements make Leeds distinctive compared to these other programmes. The Leeds course is the only audiology course in the UK that sits within a school of medicine. Our students find this is beneficial as they get to learn alongside the professions within which they work alongside when they graduated. That includes the medics, the dentists, cardiac physiologists and radiographers, so it's an interprofessional course. Around 60% of the course is theoretical and university-based, and 40% of the course is clinical and practical, so based in the NHS or the private sector working with patients. Student feedback indicates that our clinical placements are extremely well evaluated, and we're very proud of this element of the programme. Within the course, we're constantly looking to improve our students' experience, and this includes investing in the course and the use of high technology, state-of-the-art laboratories and equipment to support our teaching. Other elements that make the course distinctive include opportunities for attendance at national and international conferences, some specifically for student audiologists, and the opportunity to undertake an international collaborative research project. I'd also like to just point out that recently students have completed the National Student Survey, and the audiology course at Leeds received 100% overall satisfaction from our recent graduates. Thank you.
Thank you, Ruth. That sounds like a really exciting course. Now I'd like to introduce you to our next lecturer, Dr. John Huntress, who will showcase our MSc Clinical Embryology distance learning course.
Hello, John Huntress speaking. Yes, I'm the programme leader for the MSc Clinical Embryology. So clinical embryology is the treatment of infertility using techniques such as in vitro fertilisation. So the first course I'm going to talk about today is the distance learning course. This is a 24-month part-time course. It's delivered by online and flexible learning. So our applicants are usually already employed in an IVF laboratory. They could be embryologists, reproductive technologists, or they could be clinicians. And the entry level we typically have is a 2-2 degree or an equivalent in a relevant subject. Although we do review applications on a case-by-case basis, so if you perhaps have a lot of work experience in the field of IVF, then that could make you eligible to apply as well. So the distance learning course is quite different to other courses. It's most of your work is done from home. You visit Leeds for 3 weeks in total that are spread across the 2 years of this course. I'll explain that on the next slide. So language requirements are IELTS 6.5 with 6 in all components at least. Fees for 2020 are 16,750. And so far we've had well over 300 students graduate on this course, and the course started in 1999, so it's been going for quite a time, so we've had some good experience at dealing with distance learning. Hopefully that will reassure you. This is the course structure of the course. It's the 2 years. Just to explain how the course works. So on the left-hand side of the slide, you can see it starts in October. So in October, you can come to Leeds for a week, and at that workshop, you will do your student registration, orientation to the University of Leeds. You'll have lectures for modules 1 and 2, instruction on how to access the university facilities such as the library and IT systems, the virtual learning environments where all your learning material is, and you'll meet your tutors, of course, and so you'll have lectures and tutorials. And then you go home for after that workshop, and then you will complete modules 1 and most of modules 2 by distance learning mode, as we say. And then in June towards the end of year 1, you'll come back to Leeds to do another workshop. They'll do some exams here in Leeds, and you'll have lectures and practicals for the next few modules, which is modules 3 to 5. So then you'll go home and you'll undertake modules 3, 4, 5, and start of module 6 at home, and do that like assess coursework, writing from home and submitting to the university virtual learning environments. And then you come back in April of year 2 for the final workshop, the final set of exams, and the final presentations that you'll have to do. And then the rest of the course is the final module research project, and then graduation hopefully in December of year 2. So the modules are on the right. We've got 6 modules: fundamentals of clinical embryology, IVF and embryo culture, micromanipulation, cryology and cryopreservation, ethics and role for embryologists, and the final one is the research project in clinical embryology. So the distinctive features of the course are you can learn from home by distance learning. You've got full access to well over 30 journals in reproductive science, clinical embryology, also some free e-books, electronic books that are in the field as well. So they're really useful for you. So you don't have to have a big expense in buying books. You'll gain a professional qualification, deep understanding of clinical embryology. You'll gain the confidence to challenge the work that's done in our field of ART to contribute to the development of assisted reproductive technologies. You'll enhance your research skills. Many of our students go on to become active in research. And you'll have this global network of friends and past students, peers, and tutors. Okay, so that's going to conclude my discussion about the distance learning course, MSc Clinical Embryology.
Thank you, John. That's really interesting course. Unfortunately, Professor Helen Picton is unable to join us today, but John will happily read through the details of her MSc Clinical Embryology Assisted Reproduction Technology course. So thank you, John, for doing that.
Thank you. Thanks, Bimbo. Okay, so the next, thank you. Thank you. So the next course is the MSc Clinical Embryology and Assisted Reproduction. I'm just going to talk to this. So this is differs from the MSc I just described. This is a 12-month full-time program, very much centred in Leeds. It's aimed at recent biology, biochemistry, genetics, biomedical sciences graduates, medical graduates as well, who really want to get into the field of clinical embryology and assisted reproduction. So unlike other courses in the UK, it's very lab-based with the practical sessions. We have a module, module 6, which includes a very busy lab practical schedule. I'll explain a bit more about that in a second. So the entry requirements are a 2-2 degree or equivalent in relevant subjects, IELTS 6.5, at least 6 in all components. That's for the language requirements. The fees you'll find on the university course finder website. So you can see on that slide there, you've got some pictures of some of the students from our programs. You can see some of them in the lab doing some of the practical components. So the unique features are, so here are the modules, sorry. Yeah. The modules are shared with the earlier course I described. So we've got fundamentals of clinical embryology, IVF and embryo culture, micromanipulation, cryobiology, cryopreservation, ethics and law for embryologists. This particular full-time master's program differs from the earlier one I described in the fact that you've got this very detailed practical training module, which is module 6, which is research and reproduction, embryology and assisted reproduction technology. That includes 2 parts: comprehensive lab training schedule and ART, and a research project. So the distinctive features, of course, are a robust lab-based training module with many practical sessions. You'll learn how to perform in vitro fertilization, embryo culture, how to handle gametes, sperm and oocytes, how to perform mixed use, that's injecting sperm into the oocyte, commonly used technique in assisted reproduction. Your lectures, that's face-to-face lectures, indeed are complemented with online learning materials, so it's very much a blended learning approach. You'll have full access to greater than 30 journals in reproductive science and e-books in reproductive science. Our graduates have been successful, really successful in gaining positions as embryologists and reproductive technologists and biomedical scientists in the NHS, and some have gone on to do PhDs. So I think I'm going to conclude the discussion for that programme.
Thank you, John. That sounds like a really great course. Next, I would like to introduce you to lecturer Andy Davies, who will talk about our postgraduate course in medical imaging.
Thank you. So the MSc in Medical Imaging is a 12-month postgraduate programme looking at the science of medical imaging. Now, medical imaging, it's safe to say, is pervasive through all of modern medicine. It's unlikely that there's anybody in this room or in those that are listening at the moment that haven't had some interaction with medical imaging. What we concentrate on is the medical imaging devices themselves, the science behind them, and their applications in modern healthcare. It's not a, one thing I should say actually about the course is what it isn't, and it isn't an accredited course that will let you become a radiographer or a radiologist. This is concentrates on science. The entry requirement is a 2-2 degree or equivalent in a relevant subject, so that could be a BSc in diagnostic imaging, it could be a BSc in physics, it could be medicine, but we'll discuss who comes on the programme in just a little bit. IELTS, reasonably high with 7, average of no less than 6.5 in any of the components. You'll find full details of the course and the fees on the University Course Finder website. So the course itself is divided into a number of areas. There are set compulsory modules, and these are the core skills in medical imaging, which covers the anatomy, basic maths, basic physics that you're going to need to be able to do the programme, and also a research methods module, which will prepare you for your research projects. I'll talk about that in a little bit. So that covers statistical techniques, critical analysis, literature finding, all these kinds of things. Then you'll do a number of medical imaging modules which look at the medical imaging modalities themselves, so everything from X-ray, CT, MRI, ultrasound and radionuclide. In fact, one of the big features of the course in Leeds here is that we do cover every one of the major medical imaging modalities that are available. There's new for this year, there are a set of optional modules, which I'll show you later, which look to enable students to pick specialist subjects that really suit their individual interests or may be useful specifically for their career aspirations. And finally, in semester 3, so at the end of the program, you'll do a 60-credit research project. So this is on a piece of research of your choosing. We try to provide a whole range of projects for students actually, but we also encourage students to look to design their own research project, and it's hopefully the first step in independent research that you'll be doing. You'll see at the bottom here, Ruth, who's one of our former students. She was a radiographer from Nigeria, and she's commenting there about the top-notch teaching facilities, and John and others have commented on this in the past. Actually, our lectures are recorded. You'll see the video and the sound from the lectures afterwards. We've got a fantastic library. Our teaching facilities really are good. She said some nice things about the program team that teach on the course, which is generous with our time. So that's always nice to hear, actually. So who comes to the top one? So radiographers, physical biological scientists, medics, dentists, and there's a whole range of careers in medical imaging. So you could look in the medical imaging industry, for instance, for relevant pathways afterwards, or even an academic career or future study. So a PhD, for instance, would be a good stepping stone after this. And, no doubt, Dr. Porter afterwards will be telling you a little bit more of how you can achieve that as well. Looking in a bit more detail at the modules on the course there, you can see the compulsory modules. You have to do a research project, research methods and core skills. And then, as I said before, we cover all of the major medical imaging modalities. And you have to do at least 2, you have to pass at least 2 of those modules, but you can choose them all if you wish. And then the optional modules at the end includes issues like forensic imaging, pediatric radiography, medical image interpretation, And then 2 computer programming with MATLAB aren't running this year, but they will be available for next year. So any of you that are thinking of applying now, those 2 modules looking at the computer analysis of images will be running. And the professional issues modules lets you take and self-design a piece of study on a topic of your choosing, which is particularly pertinent within your specific profession. Okay, thank you.
Thank you, Andy. That was really interesting. I would now like you to introduce you to our next lecturer, Dr. Peter Tennant, who will talk about our brand new MSc Health Data Analytics course.
Thank you very much, Finbar. Hello, everyone. Yes, I'm talking about this new course, our MSc in Health Data Analytics, which has been designed to respond to the data revolution and the implications thereof for those working in health and those wanting to conduct research in the areas of health and medicine. So our MSc in Health Data Analytics is a 12-month full-time course with the option of doing it over 24 months part-time. And it's aimed at people with a background in quantitative sciences, which could include anything such as biology, biochemistry, biomedical science, computing, ecology, economics, maths, psychology, statistics. Essentially, if you're numerate and you're interested in the domain of health and medicine, then you're welcome. The course itself has been designed to train a new generation of data scientists with the cutting-edge skills for analysing and interpreting the sort of data that is now in excess in our society, is now available to us, but we don't necessarily have traditional training and skills to exploit. The entry requirements for this are a 2:1 degree or equivalent, and our English language requirements are IELTS 7.0 with no less than 6.5 in any of the components, and you can find out the fees on the University Course Finder website. Sorry. What's unique and distinctive about this course, not just within the UK, but so currently across the world, is that we focus very much on this area of real-world data analytics. A lot of traditional data analytics courses are focused on the analysis of experimental data. Across our entire course, we embed the concept of analysing this new form of big data that is being derived in the real world. So the teaching is then also delivered by experts who are working across both the University of Leeds sort of expertise in data analytic methods, that's within the Leeds Institute for Data Analytics, but also as applied within the context of health and medicine. So people like myself, we are both members of LEADER and the School of Medicine. I'm very much interested in statistical methods, but I'm also very much interested in their application in this domain, and that interaction between those two is vital. So what we provide is a state-of-the-art training in predictive modelling, and then most uniquely this cutting-edge training in the new area of causal inference. Our students have extensive access to routine health and medical data, which is maintained within our Institute for Data Analytics. And then we also provide them quite uniquely with specialist training in transferable and professional skills that our students will be needing in their future careers, whether that's in health data sciences, science, biostatistics, medical statistics, epidemiology, or any other area where data analytics is being applied in health. And then what we drive them towards at the end of the course is a novel and clinically relevant project, which they'll be supervised by one of our expert research staff, with the intention of driving that towards a scientific manuscript that's then hopefully suitable for publication. So the modules, just as a quick overview, are provided here. You see we provide a set of core modules. These are to ensure that everybody who comes on our course has both that thorough grounding in the core principles and also that sophisticated training as you see as we come to the modules towards the bottom, in modelling in both for both prediction and cause and inference. Then, of course, you have the opportunity to specialise in particular areas of interest, whether they are genetic epidemiology, clinical trials, spatial analytics, or in particular methods such as latent variable methods or machine learning. And then everyone in the last part of the MSc will go and carry out their own independent research project, which we hope will lead to a piece of independent scientific research.
Thank you, Peter. That sounds like a fascinating course. Next, I'd like to introduce you to Lecturer Lisa Ashton, who will briefly explain details about our new PG Cert in Cardiac Device and Rhythm Management.
Hello and welcome. So my name is Lisa Ashton and I'm currently the Programme Lead for the PG Cert in Cardiac Device and Rhythm Management. So I'm just going to talk through a little bit about what cardiac device and rhythm management is. So as a practicing cardiac physiologist, we're involved with the treatment and diagnosis of patients with cardiac arrhythmias and brady and tachyarrhythmias in particular. So what the course has been designed for is to bring lots of different professions together to look at these patients in unison. So rather than cardiac physiologists dealing with them, what we're trying to do is bring in all the professions that deal with patients with cardiac disorders and give them a better understanding of what cardiac devices are. So the cardiac rhythm and devices specialists work across a challenging and stimulating hospital and community. So there are patients that have heart failure, for instance, that are out in the community that are dealt with by heart failure nurses, but cardiac physiologists, cardiologists will have an input into their treatment. So we're trying to bring all of that together. As a whole, we combine patient care with analytical problem solving. So patients that are implanted with cardiac devices, we have to troubleshoot those and make sure that the device is working appropriately for each individual patient. So what the curriculum covers is the diagnosis and treatment options available for these patients. So all of those patients that have conduction tissue disorders. We look at the pharmacological treatment options available to them. We have the devices that are implanted into patients, as well as looking at electrophysiology studies and how that is utilised to treat and diagnose patients as well. The course is designed for healthcare professionals that are working with patients with implantable cardiac devices or patients that have got rhythm disorders. So it can include radiographers, it can include GPs, it can include nurses. There's a whole range of professions that will come across these patients. So when we're talking about implantable cardiac devices, we're looking at those that are implanted with basic pacemakers, implantable cardiac defibrillators, and patients that are implanted with heart failure devices as well. So the programme is run over a 9-month period, which with some of it is taught, and then you will have online work to do as well. There are 2 invasive teaching weeks. One is run in January and one is run in June, where you're placed at the university and you have a series of lectures by a range of specialists to deliver the core content, and then there's some additional online work that you can do to further support that. In order to attend the university, you require a short-term UK study visa to come across for those individual weeks. As I've said, it's aimed at hospital doctors, GPs, cardiac physiologists, cardiac specialist nurses, radiographers, physician associates, and any other allied health professionals that are dealing with patients with cardiac devices. The normal requirement is a 2 degree or equivalent in a relevant subject, and the IELTS requirement is a 7 and no less than a 6.5 in any component. And as with the other programs, the fees and information is available on the Course Finder website. So why choose Leeds? One of the distinctive features of the programme is the fact that you do get that face-to-face contact. Many of the programs that are running cardiac devices are online self-taught programs, whereas this one you get that face-to-face contact. Clinicians can continue their practice in their home country, so you continue working as you do in your home country whilst doing this program. There's no requirement to be in the UK for the whole duration. We utilise equipment from the manufacturers within our teaching, and we have industry-led mini practical sessions where device companies will come in and talk about their products and go through case scenarios of how to troubleshoot a patient in particular, just so that you've got that practical element that you can go away and put into your own clinical practice. Throughout the 2 weeks, you are taught by research active cardiologists and cardiac physiologists from our Cardiovascular Research Institute, and the course is structured that you get many different people inputting into the teaching. We're based within the School of Medicine, and the other unique feature is about the assessment process. The assessment process has been designed so that it's tailored to your own clinical practice. So you choose a case study that is relevant to your own practice. So whether you're a radiographer or a GP or a cardiac physiologist, that assessment is relevant to your own clinical practice. All of the content is mapped to the British Heart Rhythm Society curriculum, which is an external professional body. So you can then utilise this to go on and do your professional body exam as well. And then that would link into you to the study at another level.
Thank you, Lisa. That sounds like a really useful course for clinicians. So next I would like to introduce you to lecturer Natasha Watchorn, who will talk about our brand new PG Cert in Echocardiography, which is starting later this month for the first time.
Hello everyone, I'm Natasha and I'm the lecturer and programme lead for the PG Cert in Echocardiography. So just before I start, a little bit about what echocardiography is. It's what's used to image a patient's heart. We use ultrasound to image a patient's heart. We obtain readings that are sent to an ultrasound machine and then we translate them into live images that we can see, save and record and diagnose conditions. We treat patients with conditions such as ischemic heart disease, heart failure, adult congenital heart disease, cardiomyopathies and pericardial disease. So we have a lot of dealings with lots of patients, all the way from pediatrics all the way through the age spectrum. And our course aims to train really highly competent clinicians who will make a really valuable contribution to modern healthcare in the NHS. So the course itself is 9 months part-time. We've got 2 intensive teaching weeks in semester 1 and semester 2. In order to study in the UK, you would require a short-term study visa. The course itself is aimed at hospital doctors and GPs, cardiac physiologists, cardiac specialist nurses, radiographers, physician associates, and any other healthcare professional, allied health professionals, such as radiographers. The entry requirements to the course is a 2-2 degree or in an equivalent in a relevant study, and the IELTS is level 7 with no less than 6.5 in any components. You will find the fees available on the university course finder website there. So some of the distinctive features about the PG Cert Echocardiography is that the people on the course and clinicians can continue practicing in their home country, so they don't have to practice over here. You'll be taught by Society of Echocardiography accredited practitioners on the course, all educated there to that high level. Practical sessions we use during the university that we will be in our purpose-built ultrasound suites, so we can have access to those. And we also use equipment manufacturers within our teaching as well, so you're getting that specific teaching from them as well, and their programs and their features of their machines. We use research-informed teaching. We're a part of the Cardiovascular Research Institute, and we've got really close relationships with the British Heart Foundation and the LGI. As with all the other courses, we're part of the School of Medicine, So that's a unique feature for us. And the curriculum content is designed to fit into the British Society of Echocardiography curriculum. Also with this course, and unlike other courses in the UK, this is a cardiac ultrasound echocardiography course and not just a medical imaging. And that's really, you know, a unique point because some people get banded in with the other modalities and get forgotten a little bit. So that's a really unique thing, I think, for our people coming on the course. Thank you very much. I'm going to pass you over to Dr. Karen Porter.
Thank you, Natasha. Sounds like another essential course for medicine and healthcare clinicians. Finally, Dr. Karen Porter is here to talk about our International PhD Academy, which features a postgraduate level foundation year, which you commence before starting your 3-year PhD.
Thank you, Finbar. Yes, I'm Karen Porter, and I'm the programme lead for a brand new International PhD Academy in Cardiovascular and Metabolic Disease, which we've established in LICAM just this year. I think this is a really exciting programme because it's an opportunity for students who have minimal research experience, who can come into our institute and be guided through a PhD. Every single year, our graduate school in the School of Medicine receives large numbers of applications from potential students who live outside the UK or the EU. And these are the kind of students that we welcome here into Leeds. As you can see on this slide, I won't go through it point by point because you can read this for yourselves, but it is a 1+3 year, which I'll explain to you in a moment. It's suited particularly for international students. They must have their own funding. As you can see, it is aimed at a wide range of graduates, but we do expect the equivalent of a 2-1 degree in one of those relevant subjects. Importantly, if students have previously done a master's degree in the UK, that may take them directly fast track into year 2, and we can consider those on an individual basis, and particularly if they've also already done a master's degree here in Leeds. The IELTS requirements are the same as for the courses that have just been described. And again, the fees are available on our University Course Finder website. This is a full-time course. So how does it work? Well, as I just said, this is a 4-year bespoke programme, and we're now inviting applications for 2019 entry. The uniqueness of this course is that in foundation year, year 1, the whole focus is on personalised training for every student. So the emphasis will be on support from all of our experienced academic staff, many of whom are leaders in their field. So each student will actually do a core of common taught components that are already here in LICAM and that we believe really set the scene for them to be able to embark upon a PhD. And then in addition, the students will do optional module choices according to their individual need. So those would be selected with the student and the supervisor, and they'd be selected for them to undertake those courses. And again, this will help them to prime them ready for the PhD. They'll receive academic and practical specialist skills training throughout the whole of the first year and indeed beyond. And during that first year, they'll also do a couple of mini projects that will complement their PhD project. So what we believe is that at the end of year 1, each student has actually had enough, has some training, and they've increased their knowledge, which gives them the confidence to progress to the final period of the PhD. So in that last year, in the following years, then the students will actually focus very much like our standard 3-year programme. So in years 2 to 4, they will spend. Sorry, I beg your pardon. Where's it gone? Sorry about that. That was trick. In years 2 to 4, they will focus full time on their PhD project. And I really would like to emphasise that this year we have almost 40 topics for students to select from in a broad range of the areas that LICAM have a lot of experience in. During that time, the student will receive dedicated support from an experienced supervisory team, many of whom are world leaders in their field. And of course, they will continue to receive their ongoing academic and practical training. We really do believe this is a unique opportunity in Leeds, and I think that we're probably the first to establish such an opportunity in our School of Medicine for these talented and able students to come to the UK to study. They'll be welcomed into an established community of outstanding researchers with state-of-the-art facilities. I'd like to point out that we do accept applications all year round, but there is just one start date in October each year, and that's because of the nature of the taught modules during year one. So what we really wish to do is to encourage universities to send us their brightest students, and we can pretty much guarantee that they'll have a unique experience in the 4 years that they spend with us in ICAM. Thank you.
Thank you, Karen. That sounds like a really unique programme. Before we finish, I would like to introduce you to Dr. Piru Sukuma, who is the Institute Lead for International Development and a key supporter of this webinar today.
Thank you, Finbar. Hello, everyone. My name is Piru Sukuma. I am the Institute Lead for International Development. I'm very delighted that you have all attended this webinar today, and I hope you have found this useful to learn more about our courses and what we can offer uniquely. After the event, I will be extremely happy to discuss with you how we can help you to promote our courses further, and I am keen to ensure that you all have all the necessary information you need to promote our courses. I have just come back from a visit to India and Indonesia, where I have visited multiple universities. I have also met some of you during my visit from this network of agents for University of Leeds in these countries, and conducted a few training sessions. I hope to travel more to other countries as well soon to speak about our courses and meet people from our valued agent network. I realized during my visits to different institutes and also from talking to some of you that we have to raise our profile of our faculty of medicine and health, and build an image to enhance our opportunities in student recruitment. To that front, I'm more than happy to talk to different medical universities and schools to establish partnerships, collaborations, and research proposals together, things like that. Also, if you would be keen to meet with me or one of my colleagues whilst they are visiting your part of the world, please get in touch with me or any of the people you have just met. We will be very happy to look into opportunities and make arrangements to meet you when we travel there. Please feel free to get in touch with me, and the email ID is on your screen, and I'll be more than happy to talk about our courses and also research activities. Thank you.
Thank you, Piru. That is the end of our presentation. We would now like to invite you to type your questions into the box on the screen on the right-hand side to any of our presenters here today. They'll do their best to try and answer those questions for you. Please type in any questions you have, and we will wait a few minutes while they start to come through. So I guess in the meantime, while we're waiting for people to type in their questions, we've got a few that may be of help to the audience out there, particularly one to Andy and Davies to discuss medical imaging and find out typically which countries and which parts of the world do you find students come from when they study your course?
It's a good question, actually. We get students from the Middle East, Saudi Arabia in particular, students from Africa. I showed you some of our previous Nigerian students. This year we student from India, so quite a wide range actually. And I think one of the nice things about the program actually is that it mixes the international students that we have with EU students on the program as well as other undergraduates from a range of backgrounds. So I think it's that mixture of people that you're going to find in your classroom that's really really valuable actually. Part of the experience of coming to the UK to do a degree. That's important.
Oh, good. Thank you, Andy. Now, one question I've got for Peter about the new MSc in Health Data Analytics, which is about to launch in the coming weeks, our first cohort of students. So for next year and future years, which markets, which countries are you hoping or expecting people to come from, and where would you find that the content they'll learn will be best applied when they go back home?
Well, the content is absolutely relevant for everywhere. This is happening. You know, the data revolution is affecting every society now. So we've built it on the back of our pedigree teaching epidemiology and biostatistics, and we've tended to find that that course is attended by approximately 50% international students, 50% home UK students, and they really do come from all around the world. Every continent. We get individuals who've seen the value of this sort of thing, but I think that that's likely to increase with our focus on teaching some of these new skills that are so relevant in this new world. So really, anywhere.
Oh, good.
Okay. I'm just going to read the questions that are coming through because I'm not sure why they're not showing on the panelist thing. So one of the questions we have is from our colleague from the team in India, and she is asking if BMAT score is required for any of the undergraduate courses.
No, so unlike medicine, which requires BMAT exam at Leeds, our undergraduate course in audiology doesn't require that. So I guess the thing to remember here is that any students that are very interested in audiology that you speak to, they would first apply through the international office to the international foundation year. The details are on our main corporate website, and I guess they go through that foundation year and they pick up skills about language skills and so forth. And then during that process, they would apply like any other student to our undergraduate course in audiology and go through the multiple mini interview process, just like the current home students do so.
Okay.
So no BMAT required in addition.
Brilliant. There's another question from Ola Jumoka about whether we can get the details for Dr. Karen to inquire about any 1+3 PhDs. So are your details on the website?
They are. Yeah, I should have had the website. There's a whole information about the academy.
Okay.
Have you got it?
So one of the ways,
screen,
yeah, we can.
Yes.
We can certainly share the details of how you can contact people, and if you have any specific admissions questions for any of the programs, I believe that you will be able to contact the relevant admissions team for admission-specific questions. I think colleagues here are probably more suited to answer questions about the details of the teaching and the content of the courses rather than individual admission-specific questions. However, if any admissions questions come through, I'm sure there will be other colleagues that we will be able to forward it on to admissions who can check. If you're asking about any specific entry requirements, we will be able to answer those. We will share the presentation with you after this, so you will have everybody's contact details should you have any specific questions about the courses and the content of today's presentation.
Any other questions?
Let me just see if there's anything.
Yes, in the meantime, I know that Lisa and Natasha do some teaching out in India on occasion, and Rhoda, our program lead for cardiac physiology. So I guess if there are opportunities for one of them to meet with the in-country staff in India, maybe arrange some visits to travel to universities, they'll be heading out. Have you got any planned visits, Natasha?
Yeah, we're going out at the beginning of December, about the 4th of December, I think it is. We're heading to Mumbai, I think.
Brilliant.
So potentially there could be a great opportunity there for for Natasha to tie in with the in-country team in India and maybe visit a university or two around Mumbai and promote our PG Cert in Echocardiography and PG Cert in cardiac devices.
That would be brilliant. Yeah, that's a really good opportunity.
We can arrange that, I'm sure. There's another question that came through, which is a question again from our colleagues in India. Is the practical component on your courses, is it undertaken on dummy patients or real patients? So if there is any, you know, I suppose especially on the courses to do with...
On my course, currently we are using real people. However, we've got plans to hopefully try and get hold of a simulator as well, but I still think living on scanning humans is the best way to get the experience. So even if we do get a simulator, I'll still get volunteering, I think.
Okay, yeah, that makes a lot of sense.
For the cardiac devices, it's simulated because the companies bring in the software with real life cases, but obviously without the patient attached to them. So they can reprogram the devices and things like that as you would do a real patient, but it's not with the real patient there.
I should say on the medical imaging program that this isn't a practical radiography course, so there is no patient contact. Concentrates on the science of medical imaging rather than the practical aspects of radiography.
Okay. For the undergraduate audiology course, because they come out with a qualification to train as an audiologist, there is a high level of patient interaction. So they do some simulation-based work, some practicing on each other, and then there's a lot of work with real patients as well.
So as part of that, would they be out on placements in hospitals nearby Leeds?
Yeah, so our students spend a lot of time on placement in hospitals in the UK and in private sectors, so hearing aid dispensers, companies, both in Leeds, but also the wider Yorkshire and Humber region.
I think with the postgraduate cardiac devices and the Echo program, both of them, there is the expectations that you're working with patients in those clinical environments anyway. So you'll get your taught element at the university, but then the expectation is that you're then working in those clinical environments to get the practical skills on patients themselves in those environments.
Okay. Would you like to say something about, I know from working here, and people who have visited Leeds will know how close we are to LGI and what kind of partners we work with, but for people who have never visited the university, have not had much of an interaction with our medicine and health faculty, would you like to say something about who we work with, what the faculties and the institute's connections are? So people can get an idea of what, you know, who we work with, what people will have access to, who they will be learning from.
Okay, so on the medical imaging program, we do have lecturers on most of the modules actually that either work in radiography or the NHS. I've worked there in the past, and also radiologists that come in to talk about the clinical aspects of radiology. It's probably important to say actually that's not an onerous journey for them, given the fact that this building is physically connected to the hospital. You can walk into the hospital from my office in about 14 seconds or so, so we'll be precise about it. So yeah, it's a very, very valuable relationship actually. Some of our students will go on and do their research projects based in the hospital, supervised by NHS staff. It's very close, really important relationship for us.
So certainly some of the supervisors in the International PhD Academy are clinically qualified academics, and therefore they do have a very close association because they still do clinics and they also supervise students. And so depending upon what you choose, you may have unique opportunities to shadow some of these people and see them working in real life in the hospital.
I guess what may be interesting to hear is from Piru, who's not from the UK, is from overseas, to find out his perspectives on coming to the UK, living here and working in the institute, and what benefits and any challenges that he's found. think, Guru?
Yeah, thank you, Finbar. Just going to talk about that. We have this unique strength. Like we work very, very closely with the clinical people. We have lots of clinicians within our institute, and our hospital is attached to our research building. And during my visits to institutes in Southeast Asia, the primary question I was asked about is how much clinical contact or clinical exposure they will have. Because one thing we need to understand is most of these courses, although it is aimed at allied health professionals, in the countries we are talking to now, most of this work is taken care by the clinicians. For example, there is no set cardiovascular physiologist group, separate profession in countries like India, Pakistan, or Sri Lanka. Most of this work, rhythm management or echocardiography, it is done by clinicians themselves, like GPs or cardiologists themselves. So people who they may want to do those courses, and they don't want to go away too much from the clinics into laboratory. So it is very important to have that clinical contact, and they need not do practice, but at least a chance, opportunities to shadow the clinicians and see the working here in the hospital will be of great interest to them. So we have that strength. We have to promote that strength, prospective students. That's my humble request to the agent network or our University of Leeds agents there. Just let the prospective students know how closely we work with clinicians, and actually clinicians are part of the team, and they will have great exposure to real hospital work during their studies in most of the courses.
Can you see benefits for students who may want to study one of the PG certs in cardiac devices or echocardiography, only having to come here twice for a week-long period? Does that fit in with their working life?
Yeah, yeah. Most of these countries again have private healthcare system. The public healthcare system is not too developed, so it's private healthcare system. So once a doctor leaves the hospital for 6 months, gaining back the practice is extremely difficult. So the attractive thing about our PG certs are having to spend only a week at a time for a couple of times in Leeds. That will be hugely attractive to people. And another thing is it will give them concentrated learning during that 1 week and exposure to the international standards we practice in UK in Leeds, and which they can take back and implement in their countries. So those 2 weeks are a very good model, but as Lisa and others has pointed out, we have to work out the visa issue, like whether it can be done within a 6 months period, that 2 weeks, then they can apply, they can come with single visa application. If the 2 weeks are separated more than 6 months, they have to apply 2 times visa. So we have to work on that and make sure those 2 weeks fall within a 6 month period. Then it will be hugely attractive for us.
So it will make it easier.
Make it easier. One application. But for each visa application, the amount of document, the volume of documents they need to produce is huge. So making the process single time is hugely helpful for them.
So for both the PG certs and echocardiography and cardiac devices, both sets of visits are within a 6 month period. So there's only one visa that would be required. Right. So that's really helpful.
Yeah.
There's a question that came through about the Health Data Analytics program. So the question is whether there is background in computing is required to enter the course.
It's not required, no. We do teach, because it's a big part of the discipline as it's going, we do teach the necessary coding skills on the course. If you've not had any background in that, then that's provided, essentially. So don't worry, you don't need to have computing any more than you don't need to have maths. You just need to be interested in the area and enthusiastic.
I was asked about this during my visit to India. People coming from, you were saying, people coming from statistics background, or people all coming from biology or biomedical sciences.
Very much
so. How will you match the people during the first year? Will they be segregated, separated?
No. Everyone's the same. They're put together, but they will of course have different challenges based on their backgrounds. So the computer scientists will make everyone else look useless with their coding skills, and the mathematicians will, they'll understand the maths fantastically. The biologists will understand the context, and health data analytics sort of is bringing together all of these things. So for everyone, there's going to be that independent learning trajectory. And as a cohort, they tend to be very good at sort of teaching each other to some extent. But we find it's best to have everyone together, not to segregate, because that's what the real world will be like. That's what it's like for all of us. We were talking about clinicians and their involvement earlier. That most of the people who are teaching this course are like myself. We're sort of data scientists. But in that same way that we're physically located across the School of Medicine and the Leeds Institute for Data Analytics, we work with all these different types of people, and that's reflective of the discipline now.
So could you give us an idea of what kind of jobs could people go into after that? So if because this is a new course, presumably there aren't that many courses like that available.
No, and the challenging thing is that the market is moving very quickly. So I can tell you the sorts of jobs that exist at the moment, but I would also estimate that those opportunities are growing and growing and growing quite dramatically, and that's part of the reason we've developed this is to respond to that. There's a huge need for more data scientific training of the level and the quality that we're giving. But historically, there'd be a lot of opportunities within commercial organizations that are doing any research into health or medicine. So there's a lot of publicly funded organizations. We have lots of here in the UK, we have lots done with the NHS and their sort of surveillance systems and so on. And there are equivalents usually in every country. But you can also end up, of course, in commercial organizations where they're sort of interested in understanding aspects of health more. Quite a few of our, historically on our older courses, have ended up going into academic research, especially our international students. They have a mix of sort of international, of academic research or government research, because the skills, again, are just highly applicable to that. But any business really that's interested in health nowadays is branching out into data analytics. So
I can add some. It was interesting you mentioned this because during my visit, one of the big hospital groups, the managing director, when he presented this course, he was very excited. He was telling, he was looking for people who can guide him for the planning. Yeah. For example, how many beds he has to increase in next 2 years, how much manpower he needs, how much, for example, buying the syringes, needles, what equipment. Yes. He has to empirically pick a number out of air and has to order and live with it. Yes. He was like
modeling the number of bags. Yeah. Beds is a very challenging question.
Yeah.
So yeah, it's very much something you could answer, and we know quite a few people who have gone into those kinds of jobs. Yeah. But likewise, you can, I mean, I know someone who's gone to work at The Economist in London in their health division. They do all kinds of work, bespoke projects. So it's difficult because the market is changing massively. This is a new discipline and a new front.
Yeah, I think that's all for the questions that we've received. So I think we can probably finish. It's been just over an hour, so thank you for all your contributions.
Fantastic. So I'd like to thank everyone that's been listening today. I'd like to highlight that our presenters will welcome any further questions direct to them via email. So their email addresses are up there on your screens. So feel free to get in contact. And if your question is more of an admissions type question, they can forward it on to a colleague who will be in contact with you. So once again, thank you for joining us, and goodbye from Leeds.
And we will be sharing a recording as well, so people can go back to us and train colleagues as well. So thank you very much.